My product is done in a kind of unique and unusual way. If you are running a super busy clinic and you've got people lined up all day long to come in and have neurotoxin, you're not gonna have your staff do this because they're gonna hate you and it's gonna take up way too much time. What I have done here is I have created a separate needle for each of my injection points that I drew on her face. And the reason why I do that is these are Becton-Dixon BD ultrafine insulin syringes. So they are a tiny little fine needle. They are designed for one-time use. What most people who are doing neurotoxin will do is they will draw up 30 units. So if you've got Botox, it's 1 unit of product per 1 unit on this syringe. So 30 units of liquid in here has 30 units of Botox, and then they will take that and they will inject multiple injection points in the face. The problem with that is after your first injection, this needle is dull. So it hurts more and it causes much more bruising. In addition, you can see that you have to have if you're gonna watch, so if I'm gonna be putting 5 units in one spot and 5 units in another spot and 2 units or 1 unit, these are tiny little increments and I've gotta be watching how I'm pushing so that I don't put too much or too little in individual injection points. So if I have each specific injection point pre-drawn up, I don't even have to think about it. When I come in, I pick up what I want for the glabella. Each syringe goes into its own injection point. I have the luxury of being able to do that because I'm doing 1 patient. If I had 8 people lined up in my morning, obviously we're not going to draw this up. We're going to do it the other way. But this is really nice. If you're doing it for friends and family, they will very much appreciate this. And if they've had neurotoxin done the other way and you do it this way, they'll tell you there's really a difference. So it's nice to have a new needle for each injection point. Okay, so I am gonna have her frown and I'm gonna grab the muscle between my fingers, and in the glabella, these injections are basically into the muscle, and the way you know you're in the muscle is you're gonna go into the skin, and when you go through the dermis, you'll feel it. Sorry, I just had to poke you again, I pulled the needle out. You'll feel the lack of resistance. That tells you you're through the dermis, and then you're just gonna slowly inject, and I have that product between my fingers, and I'm just gonna kind of massage it right into the muscle. When I inject higher up in the glabella, I'm putting my finger, her eyes are closed, but her forehead is relaxed. She's not frowning. She's not using the muscle actively. I'm gonna put my thumb underneath the orbit and I'm gonna give a little bit of upward pressure, and you just wanna make sure that you're not angling your needle down where you could end up in abicularis, which is gonna drop the eyelid. So you wanna stay in the procerus and corrugator muscles. And so I'm angling again into the body of the muscle. I pop through dermis. There's no resistance now. I know I'm in the right plane, and I'm slowly injecting, and my finger is there to make sure that product doesn't diffuse into the wrong place. What I don't want you guys to do, some people have been taught, go in until you feel the periosteum, and then once you feel the periosteum, pull back, and that's how you know you're in the muscle. Don't do that. If you hit periosteum with these really sharp needles, you'll give people a periosteal hematoma. They'll have a headache for weeks, if not months. They will not like it. I have had a few patients where I've actually managed to hit the nerve in here and given them some kind of little bruising on the nerve, and they get weird paresthesias until that recovers. So you just want to be in the muscle, but not deeper than that. And again, I'm just popping through that dermis as my resistance goes away. I know I'm in the correct plane, and then I'm slowly injecting. All right, so that's how you inject the glabella. Higher up on the forehead, I stay really high. So I do just little wheels Each of these injection points is getting just 2 units of product. And then it's going to diffuse through this muscle. So I'm not going in until I hit bone and pulling back. I'm literally just gently popping through the dermis. And again, the luxury of having a really sharp needle for each injection point allows me to do that without any problem. If I have a dull needle and I'm trying to force that into these injection points, it's a much harder deal for me. So I can actually feel right when that resistance goes away, and I know I'm right where I want to be with my product, and I'm injecting and I'm creating a little bit of a wheal. These wheals will be gone in a short period of time for her, and then we wipe the ink off. For crow's feet, I normally do 3 separate injections, 1, 2, 3. Each one gets, if it's Botox, it's 3 units. If it's Dysport, it's 15 units. I'll go through that. We went through that in a separate video, how you mix it. This is Jeuveau. Jeuveau is a very similar molecule to Botox. It's a nice product to use, especially in foreheads, because you mix it with a larger volume of fluid, and so it'll diffuse over wider areas. And she likes this because it's nice and light in her crow's feet. So I'm going to do this from 1 injection point. I'm going to feed my needle in, and again, I'm staying really high here, so my injection is almost like a TB wheel with the muscle underneath. I'm staying above that vein, and I'm just creating a wheel as I pull back.